Hello everyone, today we are going to present about the fresh frozen plasma. So what is the fresh frozen plasma or FFP? FFP actually refers to the liquid portions of human blood that have been frozen and preserved after a blood donation. Then it will be used for blood transfusion. So next we will move to the specific indication for the use of FPP. These indications generally are limited to the treatments of deficiency of coagulation protein. First, it is used in coagulation factor replacement, mean it is indicated for replacement of multiple coagulation factors in patients with acquired deficiency due to liver disease or those undergoing cardiac surgery or liver transplantation. Second, it is used in thrombotic thrombocytopenic purpura or TTP. It indicates for plasma exchange or transfusions in patients. So third, it is used in reversal of warfarin effect. What does it mean? It means that it is used in patients on warfarin therapy with bleeding or that need to undergo an invasive procedure before the vitamin K could reverse the effect of warfarin or who needs on transient reversal of warfarin effects. For it is used in massive blood transfusion. Massively transfused patients who have clinically significant coagulation deficiency and hypovolemia. Fifth, it is used in treatments of immunodeficiency, mean it is used in management of patients with rare specific plasma protein deficiency. And the last one, it is used in antithrombin 3 deficiency, mean FFP can be used as a source of antithrombin 3 in patients who are deficient of this inhibitor and are undergoing surgery or who require heparin for treatment of thrombosis.
Effects and outcomes of fresh frozen plasma transfusion. So we have two types of outcomes. The first one is positive outcomes and the second one is negative outcomes. But first, let's have a look at the positive outcomes in fresh frozen plasma transfusion. The first one is associated with internal normalized ratio INR, which is an assay for evaluating extrinsic pathway of coagulation. So in FFP transfusion, the INR is validated for patients who are Coumadin anticoagulated. Coumadin is an anticoagulant for treating cardiovascular diseases. Coming to the second positive outcome, FFP transfusion allow for the replacing of labile plasma coagulation factors during several kinds of conditions, and these are as follows. A. Massive transfusion. B. Cardiac bypass. C. Acute disseminated intravascular coagulopathy. And D. Liver diseases, all in the presence of bleeding and abnormal coagulation. Coming to the third positive outcome, FFP transfusion allow for the treating of warfarin overdose. Warfarin is also termed as Coumadin. Now let's have a look at the negative outcomes of fresh frozen plasma transfusion. So what are they? The first one is that FFP transfusion allow only partial normalization of prothrombin time instead of full normalization. That's the negative part about it. Coming to the second negative outcome, which is related to the INR, the internal normalized ratio, which is not valid for patients with coagulopathy of liver diseases and factor VII deficiencies. The third one is that many risks are associated with the fresh frozen plasma transfusion, and some of them are transfusion related acute lung injury. The short form is TRALI. Coming to the others, allergies and anaphylactic effects. So these are some of the common effects of FFP transfusion. But we do have some less common effects of FFP transfusion, and they are as follows. Febrile non-hemolytic transfusion reaction, Second, hemolytic transfusion reactions, and RBC alloimmunization. We also have many more other common effects. However, most of these effects are known to be not lethal and can be treated adequately clinically. So, that was all about the effects and outcomes of fresh frozen plasma transfusion.
There are several laboratory tests that need to be conducted in selecting and monitoring fresh frozen plasma transfused in patients. Prior to the selection process, there are two tests involved, which are firstly, ABO blood group compatibility testing, and secondly, it is called RH blood group compatibility testing. For the ABO compatibility testing, the first choice of fresh frozen plasma involves the same ABO group as the patient's. If this is not available, fresh frozen plasma of a different ABO group is chosen if it doesn't possess high titer of anti-A or anti-B. However, fresh frozen plasma of blood group O should only be given to blood group O recipients. For the RH blood group compatibility testing, any RH type may be given regardless of the RH status of the patient. Monitoring the response to FFP needs to be done to serve as a guide for further supportive care. The lab test involves is coagulation test, in which prothrombin time is measured. Prothrombin time measures how well and how long it takes for the blood to clot. Longer prothrombin time indicates the blood contains less clotting factor and vice versa. The normal range is from within 10 to 14 seconds. It can also be measured based on the international normalized ratio, which is prothrombin time over prothrombin time of normal individual. In addition, near-patient testing can be carried out using a device called automated finger prick as shown in the figure. Other than that, after fresh frozen plasma transfusion, the patient needs to be monitored for several adverse effects, including, firstly, allergy. For example, urticaria. Secondly, transfusion-related acute lung injury, also called TRALI. Thirdly, infection. For example, protozoa and cell-associated viruses such as HIV, hepatitis A, B, and C. And lastly, complications related to leukocyte depletion, for example, conjunctivitis. In conclusion, fresh frozen plasma needs to be carefully selected prior to transfusion and properly monitored after the transfusion into a patient to avoid any complication from happening.